Welcome to my presentation on COVID-19. My name is Jeanette Abar. I'm an MPH student of class of 2020 with National University. Objective agenda. COVID-19. Introduction, warm-up. What does COVID-19 stand for? What do we know about COVID? What is COVID-19? How does COVID-19 spread? How to prevent the spread? Who is at high risk? Contact tracing and case management, data, and food for thought. Let's start with an icebreaker. What color describes how you feel today? Mention the color and why you picked it. For example, I pick yellow because I feel hopeful and bright like the sun. What does COVID-19 stand for? CO stands for corona, VI for virus, D for disease. What do we know about COVID-19? According to the CDC, since December 2019, the first cases of patients with COVID-19 was detected in Wuhan, China. COVID-19 is the name of the disease caused by the new coronavirus that is called SARS-CoV-2, or sometimes called novel coronavirus. We now know it affects the lungs and other organs in the human body. What is COVID-19? COVID-19 is a virus, meaning an RNA that mutates. RNA stands for ribonucleic acid. RNA acts as a messenger. Viruses need a host in order to survive. COVID-19 survives when it's inside a host being humans or animals. How does COVID-19 SARS spread? Mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes, just like you see in the picture. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Spread is more likely when people are in close contact with one another within about 6 feet. Here's another image that shows how individuals can get infected through close contact and airborne and on those surfaces as well. How to prevent the spread. Health experts recommend washing your hands for 20 seconds. Use hand sanitizer if you do not have access to running water nearby. Wear a face mask or cover your mouth and nose with a cloth. What is wrong with this picture? Don't wear the mask below your nose. Actually, this is something I see every day when I go for a walk in the park, at the supermarket, at the pharmacy. Every day when I'm outside, I notice either people are not wearing a face mask or don't wear the mask properly. And I also notice in the news a lot of journalists who are reporting on the news, they take their face masks out and leave it near their neck, exposing their nose and their mouth. Or they're doing exactly what this picture shows. To be quite honest, if you're wearing your face mask below your nose or exposing your mouth, there's really no point in wearing a face mask. That's really what it is. This is not the right way of wearing a face mask. You're exposing yourself. You're exposing yourself to COVID-19. Do's and don'ts of wearing a mask. Wash your hands. It's always good to practice good hygiene. Number one, use soap. Two, palm to palm. Three, back to hands. Four, fingers interlaced. Five, base of thumbs. Six, fingernails. Seven, wrist. Eight, rinse hands. Nine, dry hands. I know some of us may think we know how to wash our hands properly, but it's always good to have a reminder. Please remember to practice good hygiene. Wash your hands. Who is at high risk of severe complications from COVID-19? Age 65 years and older, people who live in nursing homes or long-term care facilities, people of all ages with underlying medical conditions not well controlled, including chronic lung disease or moderate to severe asthma, diabetes, chronic kidney disease undergoing dialysis, and people with liver disease, people who have serious heart conditions, people who are immune compromised, which includes cancer, smokers, bone marrow or organ transplant, immune deficiencies, poorly controlled HIV or AIDS, and other immune weakening medications. People with severe obesity, body mass index, BMI of 40 or greater. Contact tracing and case management. Is being an investigator, is finding everyone who has had contact with a COVID positive individual. With proper training, contact tracing can be done by case managers and community health workers. Public health personnel, case managers, or community health workers can provide health education on the symptoms and how to prevent further spread to others. Case managers and community health workers can also provide resources on where to get food pantry and other social service needs. Contact tracing workflow, COVID-19. Patient with COVID-19 is interviewed either by the case manager or a health personnel or even a community health worker. Patient identifies contacts. Contacts are assigned, are contacted, and the contact provides more information. The next contact provides information about who else has he or she had contact with. The health personnel, community health worker, or case manager provides information, basic health information, how to, where to get a test, also on isolation, self quarantine, and where to get food pantry, where to go to get food at the food pantry, and other social service needs, as well as connect or refer to contact to medical provider if necessary, and get tested. And if negative, contact discontinue self quarantine after 14 days from last exposure if asymptomatic. I recommend to go to the CDC website for more detailed information. When we look at how effective is wearing a face mask, we look for journal review or clinical trials. This one was called the Face Mask Use and Control of Respiratory Virus Transmission in Households Emerging Infectious Diseases. This research was conducted in 2009. The journal review showed that if the face mask was widely used, adherence would have been greater. The face mask used might reduce transmission during a severe influenza pandemic. When looking for data on cases of COVID-19, we look for COVID-19 dashboard by the Center for Systems Science and Engineering at Johns Hopkins University. It provides data from all over the world of confirmed COVID cases. and look at some numbers. According to the COVID 19 dashboard by the Center for Systems Science and Engineering at Johns Hopkins University, data of confirmed cases as of June 17, 2020. United States of America, with 2,159,446 COVID 19 cases, with a population of 330,928,170. And I would look at looking at the numbers you have for Brazil as well, United Kingdom, Dominican Republic, um, and Taiwan stands out. Taiwan has confirmed cases of 445 of confirmed COVID 19 cases, with a population of 23,815,210. Discussion of food for thought. If you were a world leader, knowing what you now know about COVID, what would you have done differently? How would have you prepare? It's important to look at credible sources like the Johns Hopkins University of Medicine, CDC, Health Department, state and city websites, PubMed, American Journal of Public Health, Journal of Public Health Oxford, Asia Pacific Journal of Public Health, New England Journal of Medicine. There are other credible sources, but these are the most common sources to look for when getting information on coronavirus and other infectious diseases. Thank you. Please remember to get information from credible sources like the CDC and your local health department.